welcome to MD Talks. Today we have a topic called GERD, gastroesophageal reflux disease. That is when the acid starts going from stomach to our food pipe or esophagus, which can have a lot of complications. What causes it? Is it your sleeping habits? Is it your eating habits? And what are the complications it can have in the long run? Today we are joined by a friend, a colleague, my younger brother, Akash Agarwal, who finished his medical school in Chandigarh from Government Medical College and then he did his residency from New York, SUNY upstate Syracuse. He went on to train further, went to University of Connecticut for his fellowship in GI, and currently he is practicing as assistant professor of medicine in the division of GI and hepatology as a gastroenterology attending at Lenox Hill Hospital. So welcome Akash, and thanks for joining us today.
Thanks so much, Mohit. Thank you for inviting me to give this talk. All right, so let me see if I can share my screen here.
So,
all right, so we'll talk about acid reflux diagnosis and management today. So, just a brief outline about the talk. So we'll talk briefly about the definition, diagnosis, management, and then we'll talk about, PPI use, which is one of the mainstay of treatments for acid reflux. So, I just wanted to briefly talk about a clinical case, which will kind of help us understand what we're talking about. And towards the end of the talk, we'll revisit the case. So this is a real life case, which I saw. So Mr. CJ is a 54-year-old male having heartburn 3 to 4 times a week who took over-the-counter omeprazole 20 milligrams daily for about 4 weeks with relief. He tried to stop omeprazole with recurrence of his symptoms, doesn't have any past medical history, no other home medications. Labs are normal, BMI is normal at 22, physical exam is also normal. So the patient was concerned about long-term side effects of anti-acid therapy and was inquiring about endoscopic and surgical options for acid reflux to try and avoid these medications for long-term. So basically, when you see such a patient, there's some questions which need to be answered. So some of the questions which we need to think about are, one, does the patient actually have acid reflux? Second, is there a role of H2 blockers or other medications in this patient? Third, has the patient truly failed PPI therapy? Should he start taking PPI BID instead of daily? And then is he actually an endoscopic or surgical therapy candidate? And we'll go through the talk and then we'll try and answer these questions towards the end. Okay. All right. So definition. So it's a very simple definition. So gastroesophageal reflux disease is a condition that develops when reflux of stomach contents cause troublesome symptoms and or complications.